Welcome back to another Score Builders question and answer video session. This video provides members of the Score Builders team with the opportunity to explore challenging multiple choice examination questions with students actively preparing for the licensing examination. My name is Scott Giles, and I will be your host for today's journey. I will read the question and provide you with an additional 60 seconds to answer the question. Ready? Let's go. A 55-year-old patient presents with sudden onset of shortness of breath and pleuritic chest pain. As part of the clinical decision-making process, a physical therapist considers the Wells score to assess the probability of pulmonary embolism. Which of the following findings would increase the Wells score, indicating a higher clinical suspicion for pulmonary embolism? Option 1, wheezing during physical activity. Option 2, bilateral lower extremity swelling. Option 3, heart rate of 115 beats per minute. Option 4, productive cough with green sputum. The Wells score is an instrument used for patients with a suspected pulmonary embolism. The instrument categorizes patients as low, moderate, or high risk based on various clinical criteria. The level of risk assists therapists in determining if the patient should be referred for further diagnostic testing. Let's explore the predictive factors of the Wells score. 1. Clinical signs, symptoms of a DVT. Minimum of leg swelling and pain with palpation of the deep veins, 3 points. 2. Alternative diagnoses are less likely, 3 points. 3. Heart rate greater than 100 beats per minute, 1.5 points. 4. Immobilization or surgery within the past 4 weeks, 1.5 points. 5. Previous DVT or PE, 1.5 points. 6. Hemoptysis, 1 point. 7. Malignancy, treatment within the last 6 months or current palliative treatment, 1 point. A student's ability to answer this question correctly will be solely based on their familiarity with the Wells score and the associated scoring system, which determines the level of risk for pulmonary embolism. Let's explore each of the options. Option 1, wheezing during physical activity. Wheezing during physical activity is more suggestive of reactive airway disease or exercise-induced bronchospasm, not pulmonary embolism. While pulmonary embolism can cause shortness of breath, it typically does not present with audible wheezing, which is more characteristic of conditions like asthma or COPD. This symptom is not included in the Wells score and would therefore not increase the clinical suspicion for pulmonary embolism. Option 2, bilateral lower extremity swelling. While unilateral leg swelling with pain is associated with deep vein thrombosis, a major source of pulmonary embolism, bilateral swelling is not specific and is more often due to systemic causes like heart failure or fluid retention. The Wells score specifically includes clinical signs and symptoms of deep vein thrombosis as one of its criteria, which implies unilateral, not bilateral findings. Option 3. Heart rate of 115 beats per minute. A heart rate over 100 beats per minute is one of the criteria considered with the Wells score, contributing 1.5 points to the total score. Tachycardia is a common physiologic response to pulmonary embolism due to hypoxia and increased pulmonary vascular resistance. This finding, especially when combined with other clinical features, increases suspicion for pulmonary embolism and should prompt further investigation. Option 4, productive cough with green sputum. Productive cough with green sputum is more typical of a respiratory infection, such as bronchitis or pneumonia, rather than pulmonary embolism. While pulmonary embolism can cause coughing, it's typically dry or hemoptysis, that is to say, bloody sputum, not productive with green sputum. Wells score interpretation. Less than 2 points equals low risk for pulmonary embolism. 2 to 6 points equals moderate risk for pulmonary embolism. Greater than 6 points equals high risk for pulmonary embolism. The scoring presented is representative of the original scoring system. There are several alternate versions of this tool that assign risk as likely or unlikely, as well as an additional variation that assigns all predictive factors as only 1 point. The correct answer is option 3. Let's explore the all-student data. 5% of students selected option 1, wheezing during physical activity. 30% of students selected option 2, bilateral lower extremity swelling. 45% of students selected option 3, heart rate of 115 beats per minute, the correct response. 20% of students selected option 4, productive cough with green sputum. System classification. This question is a cardiovascular and pulmonary systems question, which represents approximately 14% of all exam items. Content outline classification. This question is a physical therapy examination question, which represents approximately 24% of all exam items. Level classification. This question is a level 1 question, since the question requires students to possess basic foundational academic knowledge. Remediation of level 1 questions occurs through academic review of entry-level content using textbooks, review books, Basecamp, and flashcards. Academic focus area. Looking to review related academic content? Check out page 418 in PT Exam, the Complete Study Guide. Thanks for joining us on the Score Builder's question and answer video session. See you next week.